Welcome, Gil, back to the channel.
Thank you.
And today we're talking about post-injection pain. A lot of people on our channel are looking for answers about how to treat, how to prevent post-injection pain. So what's your experience with it? Welcome to this channel. I am Dr. Steven de Vos, the lifting dermatologist, and this is my partner Danny Bossa. If you want to learn more about the most cutting-edge science-based information in the world of hormone optimization, please like and subscribe. I also invite you to join my other YouTube channel, The Lifting Dermatologist. The link you can find in the description of this video.
So post-injection pain, and I'm assuming we're referring to testosterone replacement therapy, which is medically prescribed. Generally speaking, most guys are going to be injecting once per week or more frequently, okay? If it's once per week, it's generally not going to be more than 1 milliliter and usually less. And ideally, I'd like to see guys split it up twice a week or 3 times, and I know some guys do daily. So ultimately speaking, your volume, which is the key here, is going to be minimal. Volume could be anything from a couple of units all the way up to maybe, 0.3 or zero point 0.4 of an ml if you're doing twice a week. And that is not something that requires big needles. So first and foremost, your needle size. You can use anything from a 27 to a 29 gauge insulin syringe, and you literally can just draw that out of the vial and inject with it. They're ½ inch. I do like to go shallow intramuscular as opposed to subcutaneous. Subcutaneous is an injection that goes shallow into it's superficial and it's in the adipose tissue. The problem with those is that you're putting oil into oil because your adipose tissue is made up of lipids and your medication is made up of oil, and they do not mix. So now you have this solvents and these anti-contaminants in your medication, benzoyl benzoate, benzoyl alcohol. They have burning sensation and they're going to irritate underneath your skin. So if you're doing a daily injection, I understand the whole subcutaneous approach to not wanting scar tissue over time, but this is again why I like the twice a week protocol. Insulin syringes, you can go in the lateral delt, you can go in the ventral glute, which is right on the side of the hip. I know it feels like a hip bone, but there's a nice 1.5 to 2 inch little pad there. ½ inch will never hit your hip bones. And you can really go shallow intramuscular with that needle. Once you get into that muscle with that little volume and a tiny little needle that doesn't allow for seepage back out, you're really not going to experience it. One little thing you could do is you could try to warm up your vial a little bit before you inject. It helps to reduce the viscosity of the oil. The oil becoming a little thinner will help it absorb faster and not pool up and become painful. You can do this in 1 or 2 ways. You can either take a little shot glass, fill it up with hot water, drop the vial in it for 10 minutes, or I've seen guys actually place their vial in their armpit, which will bring it up to body temperature. Don't forget to alcohol swab the top of your vial after you do that though. And then lastly, when you're done, applying a warm towel, a little bit of heat to the location, and don't forget, as soon as you retract your needle, once you discard it, spend about 30 seconds deep massaging the area. This helps to disperse the oil, and this will also help stimulate blood flow, which will absorb faster. The less pooling you have, even in a non-septic abscess, just having the abscess there will generally create a little bit of inflammation and pain. So if you just follow those basic steps, you're probably not going to really have any post-injection pain to worry about too often.
You said that there was a big difference between injecting testosterone and other anabolic steroids. Explain.
There's 2 big differences. The first one being the volume. Guys that run performance-enhancing injectables are generally using much, much bigger volume. And the ml would be on the low end. I've seen syringes filled with anywhere from 2 to 4 ml in one single injection. Those are going to require longer needles, so they get deeper into the muscle, generally in the glutes. And then you have to also account for 2 other factors. One being that a lot of them are not pharmaceutical grade. They are made in underground laboratories. To prevent infection, the underground laboratories add much more solvents to their formulas because they are not tested for sterility and stability under a regulatory body like a pharmacy would be. So therefore, the concentration of alcohol-based products is going to be greater to ensure that their customers are not getting infections, because that's bad for business. If a lab puts something out and 3 guys have to go and get half their butt cheek taken out surgically, that gets out and then the guy's done. So they want to make sure you're not getting infections. They're putting a lot of alcohol in their solvent. It's going to burn. Next, if you have compounds that are a little bit harsher, like trenbolone is known for that cough, okay, that alcohol that gets into your lungs. It can be a little bit of pain. And then the actual injection site itself is going to depend on the carrier oil that is used. They may use MCT, they may use cottonseed, grapeseed, all different types of oils that the underground labs are using. And you may have an allergic reaction to one and not the other, but now that you're mixing several compounds together, that is going to have a compounding effect on the amount of PIP or post-injection pain that you're experiencing. Um, Other than that, I think it really comes down to, again, sterility, making sure that you're getting nice into the muscle and making sure that you're using a warm, compress and massaging the area. But ultimately, the bigger the volume you're going to inject, the more likelihood. Look, you're expanding tissue, you're volumizing the tissue, you're getting into the muscle, and you're causing those fibers to expand in the amount of volume that you're injecting. Putting 3 ml in an area that is supposed to be compressed, and now expanding it is going to create an inflammatory response in your body, no different than if someone came and gave you a good punch in the shoulder. So it is expected. Good news is sensory adaptation is very good at kind of deteriorating this over time. The more you do it, the less you feel it. Generally speaking, when guys begin, they tend to report back with more pain than others. And this is what we call virgin muscle. It's never been injected before and eventually it goes away. I was actually laughing. I had to go get a tetanus booster. It's due every 10 years, and I was at year 11. So I went 2 weeks ago and got my tetanus booster in my shoulder. And as soon as the nurse came in and did it, and she says, oh, you may have some burning and, weakness in your arm for the next 2 days. And I kind of laughed it off, thinking, if you know how many injections that shoulder has had in the last 10 years, and I didn't feel it. To me, the tetanus was like one of the mildest things that I've that I've had in there. But it's you'll get used to it like anything else. First time you get in a ring and start boxing, you get hit in the nose and it's not pleasant. You take someone who spars 4 days a week and you won't even wake them up with a punch. So you'll get used to it.
Okay. Once people have this post-injection pain, what kind of home remedy tips could you give them?
The biggest thing is keep it warm and massage it. Stimulating blood flow is always going to help with dissipating the medication and healing. Okay. The reason that joints and ligaments typically linger with pain for longer periods is because of restricted blood flow. Okay. Soft tissue is very good at healing because of blood flow. So if you have good circulation, that's a benefit. If it kind of just sits there and there's no circulation, no good. This is why massages often make you sore the next day, but then 2 days later you feel like you're floating because you literally just really, you're getting all that fresh blood in there with oxygen and nutrients. So just massage it. I mean, if it really hurts, massage it. Now, if it hurts to touch, and I mean pain, like if it's hot, red, and hurts to touch, you may have an infection. At that point, seek medical attention because you don't want to wait with an infection and develop sepsis or, anything worse. So there's a big distinction between post-injection pain, which is just site pain, or bacterial infection.
Okay. Thanks so much for the advice, Gail.
My pleasure.